ESOPEC is a prospective randomized trial comparing perioperative chemotherapy versus preoperative chemoradiotherapy in esophageal adenocarcinoma. We presented this trial last year at the plenary session here at ASCO and found a significant benefit in overall survival for patients receiving perioperative chemotherapy with FLOT. And this year's presentation is a little bit more going in the details why we found this significance of overall survival for the FLOT regimen. So we looked after the causes of death of the patients and the patterns of recurrence of the patients. We found out that in our collective, the patients died from recurrence of cancer. This was significant. The reasons for death without recurrence were not significant in both groups, but we found the difference in the gap of the curves in the recurrence with metastasis. And in the next step, we looked after where these metastases which were the background for dying of the patients were located. For the recurrence patterns, we found an equal distribution of local regional metastasis in FLOT and cross. But what we found a non-equal distribution in favor of FLOT for distant metastasis. And connected with the causes of death, we can very clearly say that the distant metastases were the reasons for dying of the patients in our trial. And this is the key point of the presentation this year, that we go in our data and found the distant recurrence as a pacemaker of survival.